It's a great pleasure for me to introduce Dr. Ètienne Richer, who is Director of Genomics Programs for Genome Canada, but also the chair of IC Per Med. And we have met actually both here in Stockholm before through an event for EP Per Med, which you participated in, and also I had was delighted to be invited to meet you and also Genome Quebec, which is part of Genome Canada, and we had the chance to discuss more. And we are right now also preparing a memorandum of understanding between Canada and Sweden. So for that, I'm also very grateful. So it is great that you took the time to update you, and you will also discuss precision health, which is a very important topic that we are discussing a lot also in Sweden. So at the end, many thanks for accepting to present and give an update on what you are doing in Canada, and looking forward to talk and to the discussion afterwards. So the screen is yours.
Thank you very much for the kind introduction and for the invitation to present here, as well as for adapting the schedule for it to be in a time that is that is more suitable on my time zone here. So yes, I'm Ètienne Richer. I'm now Director of Precision Health at Genome Canada. So essentially, I'm leading the Precision Health mission that we have at Health Canada, and I'm delighted to be here today to be able to talk a little bit more about that to you. And I'm very much looking forward to the partnerships that we can establish between Sweden and Canada, as there's some a lot of parallels in our approach and in our systems. So maybe I will start here and change my slides. Start by land acknowledgement. So Genome Canada, we are located in Ottawa on the unceded traditional lands of the Anishinaabe Algonquin people. As a national organizations, we support activities located on the traditional territories of many First Nations Inuit and Métis people across the country. We recognize the past and ongoing injustice perpetrated against Indigenous people as part of the colonial projects in Canada. And I must say that, like, for the particular topic today in genomics, this is particularly important to maintain, foster an ongoing dialogue as to how to better respect the control and ownership of Indigenous data and Indigenous genomic data. So I will talk a little bit more about that later during the presentation. So in terms of the landscape of precision health in Canada, we do have a governance model that really fosters consensus building, making Canada a reliable international partners as we are embarking in collaborations across the globe. There's also many strategic opportunities with major investments in precision health, including the Canadian Precision Health Initiative that I will be talking about today, but also in the genomic infrastructures in terms of all that, and especially in terms of the data and the data management to make sure that we do have sovereign national assets. We also are embarking in international collaboration. Like historically, for many years, we've been involved in the International Consortium in Personalized Medicine. That, like you've mentioned, I have the pleasure of chairing that consortium for the past 3 years now, and also actives in the European Partnerships in Personalized Medicine and strong supporters in the Global Alliance for Genomics and Health. Bringing like Canada as a whole country in those platforms. So that really demonstrates our commitment to multilateral precision health coordination. We also can build on a very diverse population, which really bring rich contribution to international databases, and that will be a focus of my talk today. We also have a universal healthcare system and trade access that make Canada an ideal partner for translating personalized medicine research into clinical implementation. And finally, despite current global uncertainty, I must say that we are continuing to make investments in transformative research programs that align with international precision medicine priorities and is not at all looking only internally at what's happening and investments in Canada. So in terms of Genome Canada, our overarching goal is really to translate genomic-driven biotechnology breakthrough into transformative solutions for Canadians and also international partners. So Genome Canada, we are a federal not-for-profit agency funded mainly by the federal government. So we are working from coast to coast to coast. But we're working very closely with six independent genomic centers that are located in regions across the country. Kurt, you mentioned Genome Quebec, but there's also centers in Ontario, the Prairies, Alberta, British Columbia, and the Atlantic. And in terms of what we cover, essentially we are covering all sectors where DNA can have a role. So health is our bigger sector, and that's my area of focus. But we also have programs in forestries, mining, and environment, for example. So we do want to position Canada as a global leader in biotechnology, innovation, and adoption. And we are doing that by leading large-scale mission-driven genomics initiatives. And I will come back to what we mean by the mission-driven approach. We have, over the years, also built a vibrant genomic ecosystem in Canada. And we also have, in terms of all the, for health, in terms of all the health benefits that we aim to achieve, we're also making sure that we connect industry and that we are developing that sector in Canada and developing in the potential impact nationally and globally. So like I've said, we are taking a mission-driven approach. So we've shifted our approach in 2020 to that mission-driven approach that is really anchored into a challenge-based identification. So essentially, we are starting from a challenge that we see in our country, in the system, in the various sectors that we are active in. And from that challenge, we are working to build a mission and to deliver on that. These are currently our four strategic directions that we're working on. Precision health is, again, a major strategic direction at Genome Canada. We have ongoing agriculture and food programs, so projects that are ongoing. We just launched, actually, this week, the Bioeconomy and Natural Resource Initiative. So exciting new funding opportunity there. And we do have commercialization and adoption of genomic technologies programs that are launched on an ongoing basis every year that are linked with all the other strategic directions. So in terms of identifying a challenge in health, it really started with the large gap identified in terms of the diversity found in genomic database. So this is an historical graph that many of you probably are well aware of, which clearly demonstrates that there's an overrepresentation of European descent genomes or participants in the genomic databases. And we could have thought initially that that would be reduced over years, but unfortunately, that's not what we've seen between 2016 and 2021. And in terms of the consequences of that overrepresentation of European descent genome, we can name a few here, like the genetic misdiagnosis, the pharmacogenomic gaps, the genotyping array biases, and also the polygenic risk scores accuracy that is much lower in some populations. And this is, again, one very classical graph demonstrating using the UK Biobank or like polygenic risk scores or prediction accuracy relative to European ancestry individuals from the UK Biobank that shows that for European descent people, the predictive accuracy of polygenic risk scores is perfect. But as we look in other subpopulations or populations that can decrease significantly. So clearly for us in Canada, with our diverse population, we saw that as a major challenge as we were moving forward to genomic medicine, and we do want the innovation that we are deploying in our healthcare system to be equitably profitable to all of our population or all people living in Canada. That led us to develop the Canadian Precision Health Initiative. The main goal here is to sequence over 100,000 human genomes in 4 years, and that is done through 12 foundational projects. And these projects in themselves each have clear scientific merit, which will have direct impact at the local and regional setting where they're deployed. But most importantly, in our mission-driven approach, we really want to make sure that all the genomic sequences that are generated through these projects are collected in one central data bank, and that data bank really represented, again, the diversity of the Canadian populations, and that this is put in the best use to generate health and economic benefit in Canada. So this is an overview of the Canadian Precision Health Initiative. Like I've mentioned, the main goal is to build a foundational data set that can be applied, that is AI ready for research, both for the private and public sectors. And we also want to make sure that we invest in programs that advance the outcomes and utility of genomic data, and that will be mostly through the second phase of investment that I will have one slide about that later, but also to, and very importantly, to implement data governance and policies. So right now, Genome Canada is in the process of ensuring that there is a unified governance of the 100,000 genomes that will be generated through that initiative, so that the data is available in the long term and respect the consent of the participants for their data to be reused in research. So all in all, what we do aim to do with that initiative is to enhance healthcare options for all Canadians, and again, independently of the ethnicity, the ethnic background of the people benefiting from those innovations. Drive economic growth as well. So make sure that the data is available for both public and private research, and to strengthen health security and data sovereignty, which is especially important in the current political context. So coming back to the Indigenous data governance, we are taking a distinct approach to Indigenous data. This is guided by the principle of the United Nations Declaration on the Right of Indigenous People, or UNDRIP, and upheld through other core principles such as the OCAP and CARE, along with distinction-based and community-led framework. So really that distinction-based really consider that there are three foundational nations or like groups in Canada: the Inuit, the Métis, and the First Nations, and that we are actively engaging in dialogue with each of these communities to define the best solutions to respect and to make sure that they can embark in these genomic projects in the way that fits and that benefits their communities and that respect their rights to control and own their own data. So this is for the Indigenous people aspects that we're taking. Now, regarding the projects, I've mentioned that there's 12 different projects. So these are not population-based for the most part, but focusing on various therapeutic areas, or although some of them are also population-based and looking more at for example, one of the very important projects that we're supporting is the cohort of Black individuals, looking at chronic disease that will be developing in those individuals, a more community-based approach. And that will be one of the largest cohort sequence of Black individuals worldwide. So we're pretty excited about projects like that. But there's also other projects focusing on very important areas such as rare disease, or all the cardiac aspects that are actually already showing clinical impacts. So if you're interested in knowing more about these projects, it's all available on our website, and I'm happy to talk more about that later. So this is kind of our view overall of the Canadian ecosystem. So we are focusing on the top blue box here, which is really the research genomic data. So I've talked so far about the Canadian Precision Health Initiative. This is working hand in hand with the Pan-Canadian Genome Library, which is another major investment in terms of infrastructure for genomic data in Canada. So essentially establishing a one-stop shop to access all genomic data generated in Canada. And this is relying on infrastructure provided by the Digital Research Alliance of Canada that the goal of that is able to support the data hosting for data generated in all sectors, including health, which is governed, in this case, the access to that data by the Pan-Canadian Genomic Library, and major initiatives such as the Canadian Precision Health Initiative will feed that library. Of course, other projects are also currently feeding that library. We can think of the CGEM OSIC data that has been generated in response to the COVID pandemic. That has been transferred and ingested by the PCGL recently. And there's other data banks, such as the Terry Fox Research Institute, Marathon and Folk, that will also rely on that infrastructure. This is not meant to work in isolation in Canada. We are integrating the international data sharing standards protocols developed by the GA4GH so that it will be able to connect in a federated approach with other national and international data banks. This is also meant to work hand in hand with the lower blue box, which is all the clinical genomic data. And there are currently major investment done and actually officially announced just yesterday in our AI strategy to allow CaiHi and other major projects such as Vital to really tackle the being able to harness and to bring together all the data, including the genomic data generated in the clinical context. So we are working closely with all these organizations and really want to create one unified genomic ecosystem in Canada. In terms of our data stewardship, custodianship approach, the first part here, data generation, is the part that Genome Canada has historically been active on for the past 25 years. So really building the ecosystem and ensuring that there's large-scale projects that will generate data and provide benefits for Canadians, both in terms of health and economic benefit. Now, in our new approach, we are also very involved in the data ingestion and wrangling. So all the part done by the Pan-Canadian Genome Library and the custodianship and governance of that data, and also ensuring that we do have a national data vault. So again, the PCGL and with the Digital Research Alliance of Canada, making sure that we have a strong national sovereign asset there, but also that this national asset is accessible to data users in a safe and as easily as possible way. So we're developing and investing in those parts really to reach a clinical, industrial, and social impacts. In terms of ensuring access to the data, we are currently in our consultation phase for the phase 2 of the Canadian Precision Health Initiative. So, and the goal of that investment phase will be to demonstrate and maximize the value of and application of CPHI data and indigenous genomic data. So we are mainly thinking of the supporting projects that will develop tools and approaches and frameworks to access that data. Again, this is an area where we are also looking forward for international collaboration with like-minded projects across the globe, because again, we think that we can easily share and co-develop some approaches. So happy to talk more about that also if any of you are interested. Looking forward, we will be looking to grow that data set. So we are preparing the next CPHI, if you want, and really making sure that this is, yes, accessible for AI to drive innovation and economic growth. But we will also be looking to integrate data across sectors and really with a One Health approach in mind. Sectors that we are already investing in, such as agri-food and natural resource, and also emerging sectors such as the defense, biosecurity, and a lot of discussions right now about dual use technologies. And of course, biotechnology can be inherently seen as something that can be dual use. So not investing in defense per se, but really making sure that some programs can be aligned with those sectors. So I'm coming close to an end here, but I can also highlight, and again, there's been some strong message and announcement just yesterday with our AI strategy. But we do have companies such as Cohere that are developing independent AI solutions that are not necessarily linked to the major international companies currently leading that scene, and that are also working to integrate, especially when we're talking about like language models, to integrate other language than English. In Canada right now, we're thinking most specifically for French, but they are looking also forward to diversify that base. And we have also some strong institutions such as AMI, Victor Institute, and Mila that are globally leading and that are currently, their funding has been renewed or increased with the AI strategy. So looking forward to seeing how this can work hand in hand with what we are developing with the CPHI. Just briefly, if you're interested to know more about how to access the data, so you can see that to the top left here, the CPHI projects, and we are, like I've mentioned, we are establishing a strong data governance here that we will be leading for the CPHI projects, but everything will be made available through the PCGL, so within the green box in the bottom, and the Digital Research Alliance data centers, all that have been sustained by the Secure Data for Health infrastructure. Like I've mentioned with the CGen HOSIC and the Terfox Marathon of Hope, there's other federated data sets or other data sets that will ingest their data, or that will, like, their data will be ingested by the PCGL. And there will also be the capacity to interact with other federated data sets using the GF4GH standards. We're also working actively to make sure that there's a trusted research environment that allow a safe access to that data. And some data also for some other data users will be more open, such as the allele variant frequencies of the Canadian population. Of course, by itself, the CPHI can lead to AI analytics and improve health and economic outcomes, like I've mentioned. But this is also done by integrating all the Global Alliance for Genomics and Health standards to make sure that it can connect not only with other national projects, but also with other international databases to really increase the critical mass of genomes and the diversity of the genomes that can be accessed for research. So with that, I will end, and happy to hand it over to you, Rickard.
So thank you very much, Ètienne, and it was really nice to hear about the sort of many ongoing initiatives, and of course it's quite exciting with your large cohort, which consists of multiple cohorts, and then how you try to fit in from different parts a joint sort of database with all the data. And I think especially, as you say, also with the indigenous populations, this will be a very important data asset. And that brings me to the first question. So in these different, in the 100,000 genomes, how do you sort of bring in the indigenous populations, or are they part of each of the different sub-projects, so to say?
It varies from projects to projects. When we selected the project, of course, one of our criteria was to ensure a diversity of the populations that were captured. Some projects actually focus on indigenous people and include indigenous researchers and PIs and are well connected with indigenous communities. So that was by design when the projects were selected. Now, in terms of inclusion of the indigenous data in the CPHI 100,000 data bank, there's an important distinction to be made here. So right now in Geneity, information won't be captured in that data bank, and indigenous participants, they have when they are consented to be part of the 12 individual projects, they have the choice. Well, first of all, they need to consent to be part of the projects. That's the first and essential layer. After that, though, it's optional for them to decide whether or not they want their data to be also part of the CPHI. And again, if it is part of the CPHI, their indigeneity information are removed to make sure that there's no research that could be done on indigenous communities that would not respect the indigenous communities' consent and benefit. So that is very important and essential. And right now we are open to, and we're working to developing various indigenous governance models for the indigenous data, and we are hoping to be able to launch more in the future. But right now, there's already the indigenous biovariant library, or the IBVL, that exists and that provide one option, and that's the third consent option for indigenous people. And that IBVL option allows for the allele frequencies and some genomic information to be used for clinical use only right now at this point, really to improve health. And that's the outcome of over 12 years or more of consultations from the SAN genome projects and what was the DNA unknown projects before. So really consulting with indigenous communities to make sure that there's a governance framework and a consent that respect the benefit and the interest of the indigenous communities. But this is an ongoing process. There's been, when the CPHI was launched, to be perfectly honest, there's the approach that we took needed to be improved. So we've worked hard over the past year to improve that, but there's still a lot of work to be done here, and that's an area actually that it might be interesting to see how with indigenous communities in Sweden with the Sami, how that will be tackled. And we're also working very closely with our colleagues from Australia and New Zealand that are like probably much more advanced than we are in terms of engaging and building some indigenous governance and managing the genomic data in that space. So it is critical that we embark on that journey. It's not necessarily an easy one all the time, and it needs a lot of dialogue and time. But this is really worth it, and it actually leads to great opportunities to have those dialogues and those opportunities with our First Nation, Inuit, and Métis colleagues here in Canada.
Thank you very much. Very interesting to hear. And if I understood correctly, the data is kept separately and is used for clinical diagnostics, the variants. Is that correct from indigenous populations? Or?
That is correct for the participants that wish to share their data with the IBVL. That is the one option that is offered to them. And of course, we also need to respect some individual rights. And there's a lot of the individual people that are living in an urban context and that may want to share their data and for their data to be used. But while respecting that right, we also need to make sure that we respect the community's right and protect them from any harms that could come from research that would not respect their own interest and their benefit.
So do you think in the future that it will be possible to make sort of aggregated frequency in different populations, or is that not the way that they want you to go?
Well, with the IBVL, there's likely going to be a way to have aggregated frequencies of alleles, and this is actually critical. And a lot of that is stemming from rare disease clinical use and diagnosis, where, of course, for again, European descent populations, we know very well what the allele frequencies and if a variant is common or not in that population. But in indigenous or other populations, that the numbers of variant of unknown significance can be much higher, leading to delays in diagnosis and in care. So that's really what was at the basis of developing that IBVL. But in the future, it could be expanded. But again, it really depends on those consultations and making sure that there's strong indigenous governance, and that after that, deciding how that data can be federated or used in aggregation with other data for the benefit of communities.
Yeah, thank you. There have come a lot of questions here, so we start with them now. So one question is, how does Genome Canada evaluate whether genomic information is actually changing clinical decisions, and what evidence do you have that those changes lead to better patient outcomes and more efficient use of healthcare resources?
Of course, the allele frequencies of our population, that's something that is directly that has direct benefit again for diagnosis of rare disease and other diseases. Now I've mentioned also the AI approaches. You can see one of the projects, for example, is at Sick Kids, one of their largest tertiary pediatric hospital in Canada. And all of the patients are offered the possibility to be part of that project. And they do have, they're currently deploying the Sick Kids AI. So they've already started implementing some clinical predictive algorithms based on the data that is generated. So these are kind of early wins and early demonstration of the benefit of having such a genomic sequencing program. So that would be the initial approach. The other thing in terms of the economic development and the development of the industrial sectors or SMEs, this is also something that we're tracking, and that is important for Genome Canada in terms of our KPIs.
So in the different projects, the 12 projects, I mean, of course, there are different types, but are you also looking into clinical utility in these projects?
Of course, I mean, each of their projects actually have a direct clinical utility. And will be, there's also I've mentioned rare disease, there's the Care for Rare Expand. And again, this is a project led by Kim Boycott, Jacques Bernier, and Jacques Michaud, that are actually directly impacting the diagnosis and care for rare disease patients. And that data additionally is now being made available through the CPHI for future research.
Very good. Next question is, are you in some way leveraging observational health data from the Canadian healthcare system, the real-world data in combination with your genomics research?
The data generated through the CPHI, this is really a research data, so properly consented, and we also that allows us also to ensure that there's some specific, or there's a coherence in the additional metadata that is collected and that is associated with the genomic data. Now, in terms of the leveraging the clinical data, again, some of the projects are situated in a clinical care context, such as the projects again at Sick Kids, or the rare disease projects. These are clinical grade genome sequencing and real patients walking in the clinic. So yes, for those projects, there is leveraging of their clinical or healthcare record data. Now, more broadly, I must say that this is more nascent in Canada, and that's been the focus of the recent announcement with the AI strategy to provide funding to KAI. So this is really looking at the clinical data in Canada, and also projects like the Vital that originally was only with a few hospitals in Ontario, but now with additional funding, they're looking to federate the electronic healthcare records of multiple hospitals across the country. So this is happening on the clinical side, and we're working with them. But the Canadian Precision Health Initiative is really focusing on the research space for now. So ensuring secondary use of the data and making sure that the data in the CPHI is as clean as possible, as uniform as possible.
So there's also a question that you connect the federated data sets through PCGL, and what health data standards and technologies do you use?
Well, the PCGL, they're integrating again the GA4GH standards such as Beacon, and making sure that the queries can be sent to database, and after that bring one unified analysis. This is not enabled yet, but should be within the next year from the information that we have from the PCGL. Again, they're like about halfway through the establishment of that Pan-Canadian Genome Library, but they are planning a public launch and having their data first available within the next few weeks, or if not months.
Very good. And then there are questions on sort of a similar vein about the translation into routine healthcare. And I mean, as you just said, it has a stronger research focus, but it's also projects that are embedded that have direct clinical utility. But in terms of value, is that something you look into? I mean, more sort of health economics analysis and so on.
Well, in terms of the value, each project, you're right, are implemented and will have direct impact on the clinical care in each of their respective areas of focus. Now, in terms of the broader value, it is something that we economic value and economic development. This is something that we are capturing, again, what the outcome of these projects are, and on the project side, and at the other end, that we will make sure that the CPHI data is much interesting as possible for all the industrial or private sector, in terms of making sure that this can be used by SMEs, and that the ways the data can be analyzed and can be accessed is an economic driver in the country here, and also for international partners.
And I also had a question about, because you mentioned clinically generated data versus consented data, and that is something that we are. I mean, we in Sweden we have both non-consented clinical data and consented data. How do you manage that in your database? Will you allow both types, or?
The CPHI and the PCGL and all the data for now that will be available in the PCGL will all be consented data. So when a data access request is submitted to the data access committee, depending on the provenance of each of the data sets, it will be able to evaluate whether or not it is possible to allow access to parts of the data based on the request. So that is on the research side of things. Now there's also and what I haven't said, but that is important, and that's probably similar to Sweden as well, the healthcare system in Canada. There's not one federal healthcare system. So we actually have one healthcare system by province, and this is the data and the delivery of clinical care is really dependent on province and territories, and they're the one responsible. So at the provincial levels, there's also some quite interesting initiative. I can think right now of in Quebec, for example, there's the Quebec Centers for Genomic Data, that is more of a clinical data bank that is generated and where the clinical genomes will be made available for research, and they're working to develop that aspect. And that data bank will be parallel to the Pan-Canadian Genome Library, but again, they're working together to implement the same standards and eventually to allow for federated approaches. So the availability of the clinical genomic and other clinical data will be really dependent on the province. Although, like I've mentioned again a few times during this presentation, with the artificial intelligence strategy, yesterday there's some announcement made to try to increase the generation of Canada-wide clinical data that would be based more on a hospital-by-hospital federated approaches strategy. So this is in development, and hopefully it will be accessible in the coming years, because of course there's immense value in the clinical data as well. And if you can link that with the genomic data, well, that would provide that will generate immense value, but we unfortunately we are not there yet, I must admit.
So thank you very much,